Hello everyone, how are you all? I'm excited to make this video regarding the case presentation just to help you all. Uh, what is a diagnosis? Diagnosis is nothing but a utilization of scientific knowledge to differentiate the disease process and to differentiate from other diseases. Coming to a case presentation simply means we are accepting the patient and recognizing he or she has a problem, identifying or recognizing the problem, and making a treatment plan for them. Let us start with the case presentation. We need to present the case, so we are not reading it like name, age, not like that. It will be we can start like this. Here is a 17-year male patient by name Prince from the Prince land with the chief complaint of a pain with right lower back region since 5 days. Patient may say like that, okay. And after the chief complaint, it is history of present illness. In history of present illness, it indicates the severity and urgency of the urgency of need of the treatment. In history of present illness, the patient complains of pain. So regarding the pain, we can know about location, duration of pain, nature of pain, aggravating and relieving factors. Coming to a location of pain, if the pain is localized, it means there are proprioceptive fibers which are responding, which are present only in periodontal ligament. So it is the origin. The provisional diagnosis may lead to the disease is leading towards the infection of periodontium. And if the pain is diffused, patient says it is a diffuse pain here, that means there is no proprioceptive fibers are stimulated, that means it is a pulpal origin. So the provisional diagnosis will lead towards the pulpal diagnosis. Coming to a duration of pain, it will be a momentary pain. This momentary pain is always a reversible type of pain. The provisional diagnosis will be. And if there is a spontaneous pain for a longer duration, it simply we can come to a conclusion of saying irreversible pulpitis. If the pain is of short, nature of pain is sharp, shooting pain on provoking, it simply means there is a stimulus of A delta fibers, and it might be origin from the dental pain, or it is a reversible pulpitis. If the nature of pain is sharp shooting pain on mastication, it is irreversible pulpitis. Provisional diagnosis may be irreversible pulpitis. If the pain is spontaneous, dull, throbbing, it may be a stimulus of C fibers which are present in the core of the pulp. So it is definitely irreversible pulpitis. Coming to the onset of pain, if the pain rises due to the sweet and sour, it is due to the stimulus of A delta fibers. So it is provisional diagnosis may be reversible pulpitis. If the pain rises due to the heat, then there may be due to the heat there may be vasodilation of the vessels, and this causes stimulus of the C fibers in the pulp, and provisional diagnosis will be irreversible pulpitis. If the pain is due to the cold, stimulus of cold, then it is basically a stimulus of A delta fibers, and provisional diagnosis usually it will be a dentinal hypersensitivity. If the pain is due to the heat and cold together, then it is the early stage of pulpitis. pulpitis, and if it is a stimulus by heat and then relieved by cold, it is a late stage of irreversible pulpitis. I shall repeat you. If there is a pain due to the heat and cold, then it is an early stage of irreversible pulpitis. If there is a stimulus by heat and relieved on cold, it is a late stage of irreversible pulpitis. And if it is a pain on lying down, it is usually a acute irreversible pulpitis. On this basis, we can come to some of the conclusion of the diseases. After the brief history of present illness, we can move towards the medical history. Medical history is very important, as we all know. Before dental treatment, medical case has to be attained. We need to start with the vital organs. We need to ask the patient by memorizing the vital organs like CNS, like for example any epileptic conditions or seizures are present, and if present they has to undergo anti-seizures drug, that's it. And then come to the CVS, which is the most important organ, cardiovascular system. Need to ask about the heart diseases, blood pressure, and any heart surgery or metal holes are there, any pacemaker is there. Then we can go to the respiratory system, any asthmatic, allergy to the patient, and we can go to the endocrine, like diabetic patient. Diabetic patients usually has to have an you need to ask whether he's on medication or insulin. Insulin, we need to be careful, so that he has to be has undertaken his medication and had proper food, so he should not be hypoglycemic during the treatment. After that, we can go for blood diseases, bleeding diseases, anemia, which is the most common, especially in women and young girls. We need to ask them. And we can go for the bleeding disease, which is very important, like when you are giving anesthesia, there may be bleeding which is unstoppable, or during if there is a overgrowth of gingiva proximally, we need to intervene or operate it. So if there is a bleeding disorder, then it may not stop. So we need to know about that thing, and we need to know about the allergies, especially a new patient first time when he is visiting, and especially we are giving an LA. So that time we need to do a test dose on his forearm, mark it with a pen, mark it like this with a pen. I am just showing you on the other side, mark it round, and we can take it and test it. If there is a very we can inject it on this marked area to identify, do not miss the point of injection, and just monitor it. If there is any reddish inflammation, need to stop it. And always we should have an antihistaminic drugs always present with us, adrenaline, antihistaminic drugs as emergency drugs. And if he is not allergic, we can undergo infiltration. Usually we give infiltration for upper teeth and a block for a lower jaw, because lower jaw is very compact bone. The LA can't penetrate through the bone to the nerve tissue, whereas upper maxillary teeth, there is a cancellous bone. The giving infiltration, LA can penetrate through the bone to up to the root apex, and it can anesthetize. That is the simple reason. So this is all about the, and one other very important, especially for young women and who we should ask about their pregnancy, which is very important because of the long duration of the treatment. The most crucial period is first trimester for the treatment, because it is a very fragile situation, Where has X-ray related, the best um, period is second trimester. Second trimester simply means 4th, 5th and 6th month. Okay, and for operative procedure, the best time is during uh, second trimester is the best option, because first and third trimester it is a fragile condition. Once the medical history is done, then we can proceed to the extraoral examination. We can see gait, habits, symmetry, and especially the lymph nodes. So lymph nodes are very very important here in extraoral examination. Just palpate them and we can track the disease, the location. For example, if the lymph nodes are palpable at the submental region, then we can track, we can think that there is an infection at lower anterior teeth. And if you palpate the submandibular glands, then the infection may be from the lower molar region. If the infection lymph nodes are palpable at the angle, it means infections of tonsils. And coming, if the lymph nodes are palpable, not associated pain, it is shows chronic infection. And if it is palpable and tender, then means it is acute infection. If it is a hard, stony hard lymph nodes, that shows malignancy. And it is a matted non-tender lymph nodes, it is usually seen in tuberculosis. These are the simple way we can differential diagnose by using this signs. After extraoral examination, we move forward for an intraoral examination. Here we see hard and a soft tissue. Soft tissue is another very important diagnostic sign tool. We can see soft palate, floor of the mouth, orifice of the glands. Another very important examination tools for in a case like when the patient says his tumor, something is hurting, and when we examine we couldn't find anything, then we can use this test. We can just keep on probing the gingiva around the tooth, and we can see there is a localized gingival inflammation and no signs of decay. That simply says that there is a proximal caries. Why? Because due to the food lodgement or due to the bacterial toxins, there may be infection that may lead to the gingivitis at the proximal area. It is one of the method to diagnose the class 2 caries. Coming to a hard tissue examination, we should know the oral status, prevalence of caries, missing teeth, caries, discolorization, and tooth wear. And by this we will come to know the oral hygiene of the patient too. With this we can come to a provisional diagnosis now. With all this thing we can say something, we can relate to some tooth. And now we can go for an investigation. Investigations we can do is X-ray, IOPA, intraoral periapical radiograph, and we can do vitality test like thermal test, heat and cold. And these are not an accurate test, but the most accurate is using a laser Doppler flowmetry, where we can see the red blood cell moving into the arteries of the pulp tissue. Coming to a X-ray or radiographic image, here it is important to interpret it. You can't say like this, it is a caries there. It is a wrong or crude method of presenting, interpreting the radiograph. Here we should start in this manner. Here is a radiograph showing 1626 and 27, and 16 shows radiolucency involving enamel, or you can say radiolucency involving enamel, dentin and a pulp, and there is a loss of lamina dura, widening of periodontal ligament, reductancy at the periapical region. This is the way of interpreting the radiograph. After this, once it is inward, then with the, if you have done a cold or heat test, on this basis we can come to a differential diagnosis. You can differentiate from the acute to chronic or reversible to irreversible depending upon the provisional diagnosis and investigation. Then we should come to a diagnosis. Very important part. Diagnosis. In diagnosis, some people, we can't say that it is a caries tooth or class 2 caries or something like that. Diagnosis, here we need to do a diagnosis status of the tooth. Status of the tooth can be diagnosed only once we determine the status of the pulp. Okay, and for example, we can say if there is a caries, then definitely the patient, we might say it is a sensitive here, or he may say food lodgement, or he may say it hurts, something like that. That means it is a pulp is responding, so it is acute pulpitis. At least patient will have pulpitis when there is a caries. So we can give a diagnosis by saying pulpitis, acute pulpitis, reversible pulpitis, irreversible pulpitis, periapical periodontitis, acute apical periodontitis, chronic apical periodontitis, condensing osteitis. These are the diagnosis. On this diagnosis, if there is a reversible pulpitis, you can go for a treatment plan. Now in that we can write we are going to do a class 1 composite restoration or class 2 composite restoration. Direct pulp capping, indirect pulp capping is my treatment plan with 3-6. As the patient has pain, severe pain and all, so here the treatment plan will be root canal treatment. This is all about the brief. This is a simple format where I am presenting you. You can go through and you can modify it and present well. All the best for you all. Okay, bye. See you. This might be helpful for you. Good day. See you.